me, Jen. We're gonna do a day in a life. I'll take you through my day as a clinic nurse and kind of show you guys what I do. I've been working as a registered nurse in an ophthalmology clinic, so that's an eye doctor's office, for about 6 years now. I have started as a med-surg nurse 5 years, and then transitioned into the clinic when I had my first daughter. The nice thing I like about working in a clinic is it's a regular shift, so Mondays to Friday, and I work from 7 to 3:30. So I do drive from my home into the clinic. I live on Oahu, and so that drive for me is about 20 miles from where I live. The clinic I work in is in town, Honolulu. So I start at 7. I usually leave the house by 5:30, 5:45. Because of COVID, I am going to be wearing my mask most of the day, unless of course I'm in my room. I do have my own office, and I will take off my mask when I'm by myself in that room. So come watch, check it out. So when I get to work, I have to do a self-check and acknowledge that I'm not sick. I don't have a cold, fever. Every time I come in, we have to scan ourselves in. This is my computer. Like I mentioned before, I have my own office, so I am able to work in here without my mask. I do take advice call. That's my primary job here in the clinic, and this is where I do all my work. This is the crash cart. It's very limited on what is in here. As you can tell, we don't have a defibrillator. This is just an AED. So if anything ever happens or we have a code situation, we actually have to call 911. This is the Optical Coherence Topography, also known as OCT test. This test is used by the ophthalmic assistants to take pictures of the back of the eye, the retina, and it's a diagnostic tool which will help the ophthalmologist in detecting if there's something wrong as far as glaucoma, macular degeneration, etc. This is the visual field machine. This helps to check your peripheral vision or your side vision. It helps the ophthalmologist to determine if your glaucoma is getting worse. We do have other machines here in the clinic, but if I went over everything, that would probably take all day. Plus, the RNs don't necessarily use all the machines in the clinic. It's the ophthalmic assistant or the ophthalmic technician that uses it. So I use an iPad mini at work. This is to take pictures of patient's eye, and it is uploaded into our electronic medical record. We use Health Connect in the hospital and clinic that I work for. This is our glucometer, and this is what we use to check blood sugars for patients. We do have a lot of diabetic patients in our clinic, and oftentimes they sometimes come in not feeling well. So it is nice to have this glucometer on the unit so that we can instantly check on the patient. So this is fluorescein. We will use this as an IV push. We will find a vein on the patient using a 25 gauge butterfly needle and inject it over 5 minutes. We use this for a procedure called Fluorescein Angiogram. We work with the certified ophthalmic assistant or technician. Oftentimes we'll call them the COA or COT. They will take pictures of the eye once we are able to see dye. That's the fluorescein in the imaging. The ophthalmologist will use this as a diagnostic tool to see if there's some type of bleeding or fluid leakage in the back of the eye. This is Visidyne. This is used for photodynamic therapy with the laser by the ophthalmologist for wet macular degeneration. We usually do this as a 15-minute infusion, and we use this IV. T Intima IV. It comes with an attached extension, which is nice, but when you finally put in the IV and you see blood return and you try to pull the needle out, The IV sucks because you end up kind of losing the vein. So I don't like using this IV, and when I have to do this procedure, it's not my favorite because sometimes I don't get it the first time and I have to poke the patient twice. This is to seal. This is used during pterygium surgery. The RNs will have to mix it, pretty much diluting it so that the ophthalmologist is able to use it for their graft during the pterygium surgery. So the nurses don't always assist in surgery. We could if we had to, but most of the time we are on phones. So here's the flu shot. We do administer flu shots in our clinic. We also have COVID shots available, but not in our clinic. We would have to redirect them to another area. So saline cloths is like an alcohol-based cleaner, which we are using on pretty much everything to clean between patient care. This wonderful thing has to sit for at least 3 to 5 minutes, and then we can move on to the next patient. Last but not least, this is my brain. Because I'm charge nurse, pretty much I'm just looking at schedules all day, the next day, and next week. So I use the small sheet as my daily schedule, and that really longer sheet I use to look at the doc schedule, and I want to make sure we have the coverage we need. All right, that's it. My 8-hour shift is over. Today wasn't actually a bad day. I spent half the day doing red flag calls, which is urgent calls for any vision changes, black spots, flashes of light. And then I'm charge nurse, so I had to catch up on some emails, work emails, not so much patient emails, because we do check patient emails throughout the day. And schedule changes. I was doing a lot of schedule changes in the past, but I've kind of cut back on doing that since that's more of a manager thing. So I just help my manager now, making sure that the schedules are updated. That's my primary job now. Otherwise, I am a nurse. I do a lot of advice calls, and I've been just working on like follow-ups for patients, make sure they come in for their appointments. So that's it. The mask is only when I'm out and about doing patient care, but if I am in my room, I don't have to wear the mask. And otherwise, in Hawaii, we have to wear the mask pretty much anywhere in public. So this is on all the time. And I'm wearing my glasses, so it sucks. I do have a tip for glasses wearers. Get a tissue and put it along the bridge of your nose, and that should help so that it doesn't fog up. All right, guys. Thanks for coming along with me. Hope you guys have a good one. Take care. Bye.